Being an expert or a specialist means that you're well versed in certain areas. As a generalization, eye care providers, many of us are jack of all trades, maybe masters of none. And as for primary care optometry, there's nothing wrong with that. This is the beauty of who we are as eye care providers. Dry eye is gaining in popularity, and thanks in part to our industry supporters, patients are also becoming more aware of the dry eye and the things that it affects them with. As such, many practitioners have approached us and asked what they need to do to become a dry eye specialist and how they can create a dry eye center of excellence. Hearing this from our colleagues certainly gets us excited. The more awareness there is about dry eye, the better care and the better treatments that we can provide for patients on an everyday basis. Generally, the practitioners are asking us what equipment they may need to buy in order to become this dry eye specialist or have a specialty in their practice. We think that this might not be the primary to address. Instead, we think that a new mindset needs to be installed first. Diagnosing dry eye in a patient who has mild or severe symptoms is easy. Deciding whether that condition is inflammatory or evaporative is also generally straightforward, and the treatment related to these conditions has relatively clearly been defined. We've covered them in previous clinical insights, and there's a wealth of knowledge on the internet about them. To us, what differentiates a specialist or a specialty practice is the ability to diagnose early disease and prevent or slow progression. In this, we're plugging the hole in the boat rather than just bailing water out. We as eye care providers wouldn't consider someone to be a glaucoma specialist if they waited for all their patients to have definable visual field loss before they ended up treating them. Instead, a specialist in this area identifies early disease and treats to slow and stop the disease regardless of where the patient is at. With dry eye, we need to think the same way. If there's an alteration to the lacrimal function, the meibomian gland function, or an alteration of the ocular surface, then the patient has dry eye, regardless of where they're at with symptoms. Being a specialist means that you treat the disease across the spectrum, but especially in the early stage. Imagine if we could go back and initiate treatment early in the disease process to our current dry eye patients. How many of them would have advanced to the stage what they are now? Knowing what we know about patients who have been treated versus those that have not, we can easily surmise that the majority would be better off. We would argue that the true specialist is the one who can move the happy patient into treatment and keep them happy.